Hello Cornelius, how have you been since our last check-in? I know you were sick with the flu the last time I came by.
I've been feeling pretty good. I think I finally got rid of the flu. I do feel like I have been hungrier recently, which must mean I'm feeling better.
Well, of course we want you to have an appetite. I'm curious if you have felt thirstier too?
Now that you say that, yes, I have been drinking a lot more water recently too. I figured that was why I've been going to the bathroom so much. What goes in must come out.
You make a good point. How many times a day would you say you have to go to the bathroom?
Oh, probably about 6 times throughout the day, and maybe 3 times during the night.
Wow, that sounds like it could be disruptive to your daily activities.
Yeah, it has been kind of a pain, but I didn't think much of it.
Hearing these things does make me think we should get your blood sugar checked, since those can be signs of high blood sugar.
Oh no, does this mean that I have diabetes?
We won't know until we do the tests, and I can't diagnose you, but I am going to call your doctor and chat with him so that he knows what I have learned from our visit today. Is there a time that would work for you to go in and see him?
I can go in any time. It sounds like I had better make an appointment for tomorrow.
Oh, great. I will get in contact with him, but before I do, are there any other things that have changed or been bothering you?
No, nothing really comes to mind.
Well, I'm looking at the results of your blood tests and I think your nurse was right. It appears you have diabetes.
Oh no, that sounds very bad. Is that bad?
It certainly can be. The good news is that if we can keep your blood sugar low and monitor you closely, we should be able to keep you from having serious problems in the future. It's going to mean making some significant changes, but I'm hopeful that we can keep this disease from progressing.
Well, I have a nurse coming once a week because of my disease spells, and I'm already taking a bunch of medications. Plus I just had the flu for the 3rd time this year. Could treating this maybe help me?
Absolutely. I'm hoping that once we can bring your glucose down you'll feel a whole lot better. Your immune system should work better, you shouldn't have to pee so often at night, and I suspect you'll sleep better as a result.
Okay, well that part sounds good.
You were very fortunate that we caught you in the early stages of this. Your A1C isn't very elevated, and you aren't having many of the symptoms that would concern me. I'm going to start you on a low dose of metformin, but the main thing you'll need to do is change your diet and start exercising.
Exercising?
Yes, right now you're doing fairly well, but if we can't control your blood sugar, I'm concerned that you could wind up with nerve pain, blindness, kidney damage, and a number of other very serious problems.
Oh, blindness. Well, that's not good. You know, Fran's always going golfing. She always wants me to throw on one of those stupid visors and come along, but I hate sweating and I hate going outside. Does golfing count as exercise?
Absolutely. Wear some comfortable shoes and some sunscreen and go spend some time with your wife. I think that's a great idea.
And my Pringle, Oreo, pies? I guess I shouldn't eat those?
No. They sound super gross, and also you're going to need to significantly limit your intake of sugar and fat. If you can lose 15 pounds over the next 6 months or so, it could make a big difference toward how seriously this disease is going to affect you. I recommend you take up golfing, stick to lean proteins, cut out the sugar, and eat vegetables with every meal.
Huh. Well, at least I'll look better in my Speedo.
Yes, there is that. I think that's an excellent goal and I think it will make Fran very happy. I want you to see an ophthalmologist to make sure your eyesight is okay, and I'd like you to see a dentist about that gum pain you're having. Do you have a dentist you like?
Yeah, my dentist is pretty great. I think I'm due for a cleaning anyway.
Wonderful. I'm going to write you a referral for the ophthalmologist, and I'll make sure the nurse knows about the metformin you'll be taking. I'll also talk to her about helping you stay motivated with your diet and exercise.
Fine. So another pill, no more Pringle Oreo pies, and I have to start golfing. Plus I need to get my eyes and my teeth checked. Is there any good news?
Well, hopefully you are going to look much better in your Speedo. This is Dr. Dean.
Hello, my name is Dr. Tran, and I'm calling from Incisive Dental Practices. I am calling about Cornelius Fisk, date of birth July 3, 1941, who is a patient of yours. He came in today complaining of tooth pain, and I found that an impacted third molar was the cause. He will need a tooth extraction, and there is a risk of infection. Given his diagnosis of diabetes, I would like to consult with you about what to do to ensure the patient's safety.
Alright, let me pull up the medical record for this patient. Ah yes, I saw Cornelius a few weeks ago. I started him on some medication and instructed him to change his diet and begin exercising.
I am concerned about the possibility of infection after this extraction. Do you think it would be appropriate to prescribe him prophylactic antibiotics?
From the nurse's notes in his chart, it looks like Cornelius has been keeping his glucose under control pretty well. I think it's safe to perform the extraction, and I don't think he'll need any antibiotics. Just make sure to follow up with the patient and check that he's healing properly after the procedure.
Great, thank you. I will let the patient know that we can go ahead and perform the extraction. Alright, you should be all set. I will need to follow up with you within 1 week to make sure that the extraction site hasn't gotten infected. If you start to notice any symptoms such as fever, pain, or pus near the extraction site, please let us know as soon as possible.
Okay, if I feel pain or if I see any weird things around my tooth, I'll let you know.
I'd also like to contact your home nurse, since she will be seeing you soon. I will let her know that you've had this procedure and to look for any signs of infection, okay?
Sounds good.
Do you have any questions for me?
What should I take after the numbing agents stop working?
You can take some Tylenol for the pain if you need to.
Okay. Well, I guess I'll see you in a year for my teeth cleaning then. Take care.